It's my pleasure to be here. It's a tutorial session. I will be discussing about Lima harvesting in a minimal invasive technique. How can people trust the harvest unless they see it sown? So, to become a good conduit harvester, you must show your dedication, patience, and hard work, especially if it is through a single hole. This is some histological changes of the vessels. We know that Lima have some special histological changes. The non-fenestrated internal elastic lamina is well developed, shedding the media from the harmful luminal stimuli, preventing initiation of intimal hyperplasia. Additionally, the media has more elastic fibers and less smooth muscle cells, which protects against the development of atherosclerosis and vasospasm. So it also has some special physiological characteristics. There is a significant large quantities of vasodilators such as nitric oxide and prostacyclines, resulting in greater endothelial dependent relaxation. Left internal artery is considered the gold standard conduit for the revascularization as its patency is very high. Already Chirag told about this. Why is Lima harvesting is so important? We know it very well. It is the routine practice in cardiac surgery to graft Lima to LAD to achieve benefits. Lima harvesting is considered one of the most important steps in coronary artery bypass surgery. This is the anatomy of the internal mammary artery. It arises from the anterior surface of the first part of the subclavian artery, ends in the 6th intercostal space. Its average diameter is 1 to 2 millimeter. It travels downwards on the inside of the rib cage, approximately 1 centimeter from the side of the sternum. It is accompanied by the internal thoracic vein. The gap between the artery and lateral border of the sternum increases when going down up to 1.1 centimeter to 1.3 centimeter at the 6th intercostal space. There are a lot of branches of Lima, and Lima harvesting through a single hole or in minimal invasive is very much challenging. Long learning curve, and also we needed the instrumental support. It needs advanced training and good experience and expertise in open cases. Adaptation is time consuming. Before harvest minimal invasive Lima, you should be confident to harvest Lima in the conventional cabbage. I always think the key points of minimal invasive Lima harvesting is positioning and incision. I always try to keep the patient semi-right lateral decubitus position with the left arm extended to avoid any traction to prevent brachial plexus injury. You should be flexible if needing to change the intercostal space to one space above or below, all through the same skin incision. I always give the incision is about 4 to 6 centimeter. In men, usually just below the nipple, and women below the breast along the inframammary crease. Before incision, I always try to coincide with the X-ray of the patients, because the X-ray guide you in which space you will give the incision. And very interesting thing, another thing is thoratract. When you put your thoratract and the arch suspensory retractor, you should take care of Lima by its blade. During insertion of the triangular thoracic retractor blade, care should be taken not to point it towards the right shoulder. Rather, it should point more towards the left mid-clavicular line to prevent Lima injury. Here, some short video I want to show you. This is the positioning of the patient. I always try to give a space in the sternum for emergency sternotomy. Here I given the incision just below the nipple and insertion of the Lima blade through the thorax tract and the arch suspensory retractor. You can see that very carefully. I'm using the long tip diathermy and minimal invasive Lima retractor. The Lima was either harvested in a skeletized, semi-skeletized, or pedicle fashion combined with its accompanying vein and tissues. The Lima can be found medial to the intercostal space incision. Lima may not be visualized as a whole, but better to start where it is seen more prominent. The tip of electrocautery was used as a dissector, and care was taken to avoid touching the Lima itself as much as possible. The branches were clipped and cut with a scissor. You can see that I am pulling the Lima started from distal to proximal. See it carefully. I cut the distal end by clipping and use the Lima forceps and clipping the branch and use the electrocautery for dissection and burn the muscle and the fat and pulling the Lima very carefully. I'm using the electrocautery at 30, sometimes maybe in 40 for the cutting of the muscle. So it's very essential and do it very carefully. You can see that the length of the Lima, you can see it's a very good length. When you see that your length is to the line of the incision, then you can see this length will cover the apex of the heart. I'm using 5/0 to hold the Lima, and this is the Lima flow. It's very good flow. The advantage of Lima harvesting: less postoperative pain, less recovery time, decreased risks of medistinitis. Left internal mammary artery harvesting with minimal invasive technique is safe and has no negative impact on the quality and integrity of Lima. The law of harvest is wrap more than you saw an act, you wrap a habit, saw a habit, and you wrap a character. Saw a character and you reap a destiny. Thank you. Thank you all.
Thank you, Dr. Asraful.